So today we will be discussing about embolism and mainly the pulmonary embolism. So before learning about pulmonary embolism, we should be clear with what is an embolism. So embolism is a detached intravascular solid, liquid, gaseous mass that is carried out from its point of origin to a distant site, and at the distant sites it often gets enlarged and causes dysfunction or infection. So, depending upon the size and the position of the embolus, it can cause dysfunction, infarction, or any other clinical significant features. So, embolism are of these types. It may be pulmonary embolism, systemic thromboembolism, fat embolism, air embolism, amniotic fluid embolism. As we discussed here, it is any solid, liquid, or gaseous mass. Instead of these, it can be any air bubble, a fat particle, a bone marrow particle, or a tumor particle, which may be dislodged and can cause dysfunction or infection. So today we will be discussing about pulmonary embolism. Pulmonary embolism is the most common cause of thromboembolic diseases. These pulmonary embolism generally originate from embolus in the neck, as we have discussed earlier. It originates from some point of origin and is dislodged at a distant site. So pulmonary embolism, it originates from deep vein thrombosis and are dislodged into the pulmonary artery. Seeing in this diagram, we can see if there is some thrombus formation here. This thrombus may originate from the vein in the leg and may go into the right atrium of the heart, then to right ventricle, then it will go to pulmonary artery. So here pulmonary artery, it can cause the blockage of the pulmonary artery at any point, maybe here, at any point. So the sites which are depending upon the size of the thrombus, it can occlude the main pulmonary artery, the pulmonary artery at its bifurcation, or smaller branching arteries. Here we have a diagram showing a thrombus which has occluded at the branching point of the pulmonary artery. This is the branching of the pulmonary artery, and this is the thrombus. So I highlighted this thing. And some facts about pulmonary embolism. This is a very clinically silent problem. If the size of the embolism is small, generally it is small, but it may cause sudden death or acute right heart failure when the size is more than 60%, so that it obstructs more than 60% of the lumen of the vessel. Now, depending upon the site, if it is in a medium-sized artery, it may cause pulmonary hemorrhage, but it will not cause infarction. And in small end arteries, it will cause infarction. So the reason is that if a medium-sized artery is blocked, there are bronchial arteries still left, which may supply the lungs and prevent it from infarction. But if small end arteries are blocked, it will cause infarction as well as pulmonary hemorrhage. So there may also be conditions in which there are multiple emboli, multiple small emboli, which may cause pulmonary tension and also lead to right ventricular failure. So these were some facts about pulmonary emboli.